We have Dr. Mike Whitaker. He's an endocrinologist and assistant professor of medicine. He did his medical school training at University of Calgary, followed by residency and chief residency in internal medicine at Vancouver General Hospital, and then fellowship in endocrinology and metabolism at Mayo Clinic. And something interesting I just confirmed with him is that he's a former Olympic swimmer for the Canadian team in 1972. And he's a phenomenal breaststroke swimmer. So he's going to be talking about fatigue and when it's not endocrine.
Thanks, Jane. I think that was back before a lot of people in this audience were even born. Anyway, I'm delighted to be up here again to present a talk that I actually was supposed to give last year, but a rotator cuff got in the way and dictated otherwise, so I'm able to present it this year. And it's actually kind of fortuitous because some studies have come out that were applicable to this talk that I've actually incorporated in here. And they've given me an hour. I'm not quite sure why I get an hour for this, but I probably won't need a whole hour, but it does give me time to kind of expand a little bit and maybe tell a story or two. To begin with, I've got no disclosures like most people in Mayo. We're pure as the driven snow. But this morning, this is an interesting story. It goes back about 1.5 years, almost 2 years ago, when Carolyn approached me and said, "Mike, can you give a talk on endocrine causes of fatigue?" And I thought about it, and I went back to my office, and I pulled out our endocrine Bible. This is Williams' textbook of endocrinology, and it's some 2,000 pages of everything endocrine known to man. And if you look at the symptoms of all of these various disorders, almost all of them include fatigue. So I said, that's not going to work. That's just too much. I can't do that in the space of half an hour or an hour. So I thought about it, and I got back to Carolyn, and I said, well, let's turn it around. I said, let me highlight some issues when fatigue is not related to the endocrine system, because there I can deliver some points and messages that are applicable to the primary care doc. So that's what I put together. And this talk has me not only looking forward to giving it, but very anxious and nervous about giving it, because I'm going to be saying a number of statements that some, and I apologize ahead of time, some in the audience may find inflammatory. I'm not here to inflame. I'm here to inform. But because of the statements that I'm going to be putting up here that some may take the wrong way, for the first time in 35 years of giving talks, I'm actually going to have a disclaimer and put this up here, is that the statements and opinions of the speaker, what I'm going to tell you is published or is backed by published guidelines from mainstream endocrine organizations, which is largely Western medicine. So here's my rider. Everything I tell you, I have a public